It is my great pleasure now to introduce Dr. Simon Davidson to you, who is Head of Child and Youth Advisory for the Mental Health Commission of Canada and the Division of Child and Adolescent Psychiatry at the University of Ottawa. Dr. Simon Davidson.
Hello, everybody. This is really an important occasion. In many ways, it's our first. And that is absolutely wonderful that people have made the effort to be here for such a very, very important event, Mental Illness and Mental Health Week for Children and Youth. Valerie did a fabulous job. What a great advocate she is. I'd really ask you to give her a round of applause. And what about Sarah Cannon and all the work that she does? You know, for a long time we've been talking about the importance of child and youth mental health for a very long time. And unfortunately, we haven't been able to garner the resources our children and youth with mental health issues need and deserve. I was just talking with Gordon Floyd, the Executive Director for Children's Mental Health Ontario, and we were agreeing that we seem to be at a tipping point, and we have to make sure that that tipping point actually tips now. So as Valerie was saying, and interestingly we have a lot of similar things to say, without mental health we have no health, no health. So it, meaning both mental health and mental illness, all begins with our children and youth. So from the mental health perspective, ensuring that our children and youth are of as sound a body and as sound a mind as possible, in other words, that their mental health is as good as possible, gives our children and youth their best possible chance of both doing well in school and in life. From a mental illness point of view, as Valerie was mentioning, more than 70% of adults living with mental illness had their onset at an age less than 18. So, health promotion and illness prevention, as well as early identification and early intervention in child and youth mental health, will reduce the number of adults living with mental illness. So for both the reasons of the best possible mental health and improving mental health problems as well as we can, it, meaning mental health and mental illness, all begins with our children and youth. And I will tell you that the investment required to address the health of our children and youth is an extremely modest investment compared with many of the investments that are currently being made. I will also tell you that when we decided, and many governments around the world decided, the only way out of the fiscal downturn was to spend our way out of that, I don't get it. I don't understand why the spending is on bridges and roads and buildings and not on our people. So consistently, over the last 20 years, our provincial governments, and in that time span there have been all three governments, political parties in power, have failed to address the serious health need of our children and youth with mental health problems, even to the extent that they address the physical health needs of our children and youth with physical health problems. We also know that 1 in 5 children and youth have a diagnosable mental illness, and also, as Valerie was saying, only 1 out of 5 of those received any kind of help in the previous 6 months. Just think about that, because our children and youth don't vote. And if you think about, I'll use Valerie's example again, hip and knee replacements for adults, if only 1 out of 5 adults who needed a hip or knee replacement got one, I suspect in this country governments would fall, and rightly so. But equally rightly so, it should be no different for our children and youth with mental health problems. I have to tell you that many of us have tried many times before to make advocacy initiatives work so that we can get the resources our children and youth with mental health problems need and deserve. We need the resources, and we do need to deliver services a little bit differently with more health promotion and more illness prevention, in my view. But the fact is, our advocacy efforts have failed. And I really hope that Gordon Floyd, I agree with him, is right, that we're right at a tipping point. Why have our efforts failed? Well, I think they've failed, one, because the professionals that are working in child and youth mental health are very, very passionate about their work. It's not work for them, it's their passion. And in fact, we're too nice, and nice doesn't work. Nice works with our children and youth with mental health problems and their families, and that's where we will continue to be nice. But nice does not work when we're looking for more resources for our children and youth with mental health problems. Also, we've been too fragmented among different healthcare providers in the mental health area. We have to come together and work collaboratively. And then the other thing that Valerie mentioned as well is the stigma of mental illness. And so I applaud you for being here today. I applaud you because in a way you're breaking down the barriers of the stigma of mental illness. Thank you so much for being here. So what I can tell you, and I'm very proud to tell you about this, and you'll hear a lot more of it going into the future, is that we are going to be launching what's called the Fairness Campaign. Fairness meaning services at least equal to what physical services look like in this province. So the Fairness Campaign brings together, that's the important part, it brings together a hugely important group of people who are all standing solidly together. We are led as a group by parents for children's mental health, and by youth from the New Mentality, and included in the coalition all of Labour, Children's Mental Health Ontario, child and youth mental health agencies, service providers, researchers, and educators. And we are going to work in unison, calling on government and all political parties to do what is right and necessary for our children and youth with mental health problems. Provide appropriate resources so that we can deliver services differently in a way that better meets the needs of our children and youth with mental health problems. Their mental health matters. It will take a substantial difference. It'll make a substantial difference in their lives, for them, for their families, for our communities, for the Canadian fabric, and on top of it all, it will even in the long run save healthcare dollars. Ladies and gentlemen, without mental health, we have no health. Thank you very much.